what we did with the ENZA-p study with the prognostic and predictive biomarkers, we really wanted to see how the PSMA-PET, screening PSMA-PET on this randomized phase 2 study impacted the outcome of the patients. So we looked at two things. Firstly, we quantified all of the PET scans in 160 patients who received treatment on this randomized trial, and we looked at total tumor volume, and we looked at SUVmean. So total tumor volume of all the lesions with cancer, and SUVmean, meaning the mean voxel intensity within all those tumor deposits. And what we found is in the patients who were randomized to enzalutamide versus enzalutamide plus lutetium PSMA, we got quite significant differences between the two. So total tumor volume in patients who received enzalutamide really stratifies patients into responders and non-responders. If you had low volume disease on your PSMA total tumor volume, you had a 20-month overall survival with enzalutamide alone, compared to a 39-month overall survival if you had low volume disease on your PSMA-PET. In the combination arm, the difference was really not very much at all. So it looks like PSMA total tumor volume is both predictive and prognostic for overall survival with patients who are receiving enzalutamide for first-line enzalutamide for metastatic castrate-resistant prostate cancer.
Very interesting.
The other thing that we did was we looked at SUVmean, which is a measure of intensity on the PSMA PET scan, and we know that SUVmean is very predictive for survival and depth of response in patients receiving lutetium PSMA monotherapy. But in this analysis, where we used enzalutamide plus lutetium PSMA, SUVmean was not predictive or prognostic. So it means that when we look at SUVmean, if we're not going to be giving lutetium PSMA as monotherapy, if we're going to use it in combination, we have to be very careful how we interpret it. So I think that the biomarkers that we have found in the study with PSMA-PET are really going to be very significant. PSMA total tumor volume stratifies patients for survival, and SUVmean does not with enzalutamide plus lutetium PSMA.